This video follows from my previous video on the biochemistry of vitamin C and is going to look at what studies have been done on how much vitamin C humans need and try to estimate the optimal intake. The first studies that I'm going to look at are the depletion-repletion studies, where subjects are deprived of vitamin C and then basically the researchers just kind of see what happens. Once the subjects are depleted of vitamin C and they're kind of starting to fall apart, the researchers then give them vitamin C in controlled doses. These types of studies are very good for seeing how much of a vitamin is needed to keep someone alive in the short term and stave off the really bad effects of deficiency. There have been two depletion-repletion studies done on vitamin C. One is the Sheffield study done in the 1940s and the other is the Iowa study done in the 1960s. These studies both found that to prevent the really serious effects of vitamin C deficiency, what would be called scurvy, you only need about 5 to 10 milligrams per day. However, in the Sheffield study, it was observed that some subjects had impaired wound healing. The wound healing came back to normal at about 20 milligrams per day. So at 20 milligrams per day, all of the very obvious signs of scurvy were gone. But I think it's very likely that 20 milligrams per day is still well below the optimal intake of vitamin C. This is a graph from a study done in 1996 which shows the relationship between vitamin C intake and blood concentration. As you can see, there's a sigmoidal relationship between intake and plasma concentration. Below 30 milligrams per day, plasma concentrations are around 11 millimoles per litre. Above this intake, plasma concentrations increase steeply and plateau at around 80 millimoles per litre, which happens at intakes of in excess of 200 milligrams per day. Different organisations have different recommendations for vitamin C intake, but they're normally between 40 and 60 milligrams per day. As we can see from the graph, at 40 or 60 milligrams per day, plasma concentrations are still well below the plateau. Similarly, at this intake, the total body vitamin C is at about 0.9 grams, which is still well below the maximum, which is about 1.5 grams. For this reason, I think 40 milligrams should be seen as a minimum, and I think there are probably benefits up to about 200 milligrams per day. It is possible that the ideal blood concentration of vitamin C is below the saturation point, but I find that unlikely. The reason for the plateau is because any additional vitamin C is lost in the urine. If a lower blood concentration of vitamin C were preferable, then the renal threshold could have evolved to be lower. Another thing to note is that vitamin C is absorbed by active transport in the gut. This means that the body expends energy on getting vitamin C from the gut to the bloodstream. Above a certain level of intake, most of the vitamin C in the gut is left there and excreted in the feces and never makes it into the bloodstream. So I think it's unlikely that the body would have evolved to expend energy actively transporting more vitamin C from the gut to the bloodstream than it actually needs. Okay, so now I'm going to talk about how certain circumstances may mean that particular people need more vitamin C. The first is women who are pregnant or lactating. Babies need at least 8 milligrams per day, so a pregnant woman's need for vitamin C is increased by at least 8 milligrams. During lactation, 20 milligrams per day of vitamin C is secreted in milk, so nursing mothers will also need more vitamin C. Another group that might benefit from more vitamin C are smokers, because smokers have a vitamin C turnover which is 50% higher than non-smokers. So far we've looked for a minimal level of vitamin C requirements, but is there a level of vitamin C intake at which it becomes toxic? Essentially, can you have too much vitamin C? Overall, vitamin C is very safe and can be taken in large doses with very minimal side effects. However, there are a few things to bear in mind. One thing that can happen is vitamin C not get absorbed and then stay in the gut and draw water into the gut, causing diarrhea. That kind of thing can start to happen at vitamin C intakes of about 5 grams per day. Another potential problem is increased risk of kidney stones. One of the end products of vitamin C metabolism is oxalate, so if someone's getting a lot of vitamin C, the amount of oxalate in the urine increases. One of the most common types of kidney stones is calcium oxalate kidney stones, so vitamin C can increase the risk of that. Finally, in people with increased risk of hemolysis, which is where red blood cells burst, they can get more hemolysis from high intakes of vitamin C. People who need to be aware of this are those with glucose 6-phosphate dehydrogenase deficiency and paroxysmal nocturnal hemoglobinuria, and any other diseases that predispose to hemolysis. So in summary, I think there's probably benefit to vitamin C up until intakes of about 200 milligrams per day, where most of the benefit will have been achieved. I think a good amount is probably about 500 milligrams to 1 gram per day. At that level, you can be very sure that you're getting all of the benefits possible and still well away from any toxicity. In another video, I'm going to look at what studies have been done on potential benefits from supplementing at higher levels than this for things like colds, cancer and aging.